Hello, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss, are antidepressants the answer for chronic pain? Antidepressants are one of the most prescribed medications in the U.S., but can carry with them a negative connotation. Even though there are millions of people in the U.S. taking them, the general public still frowns on the idea of treatment with antidepressants. Antidepressants are a hallmark for the treatment of chronic pain today. After all, some of the most commonly used medications were initially developed for something else and used off-label to treat another condition, and antidepressants are a great example of this. I think the misconception is in the name, antidepressant, which certainly doesn't suggest pain relief to the layperson. Instead, people feel labeled as depressed or incapable of being in control of their emotional aspects. There is suggested to be a strong biological and psychological connection between depression and pain. Depression is largely based on the dysregulation of neurotransmitters serotonin, norepinephrine, and dopamine, whereas chronic pain is largely based on a dysregulation of the neurotransmitter serotonin and norepinephrine. Patients with depression may also experience comorbid pain, explained by the dysfunction of serotonin and norepinephrine. When you live with chronic pain, you're more likely to develop depression as a result of the constant bombardment effect of the continued pain that you're in. So essentially, pain and depression share a reciprocal relationship. Your clinician should determine the etiology and basic parameters of your pain before deciding on medication like antidepressants for the treatment of pain. Pain parameters include location, effect on function and activities, levels at rest and during activity, quality, radiation, medication history, precipitating factors, and timing. It's a lot to take into account, and clinicians have been known to disregard these parameters, and thus ineffectively treat pain conditions like fibromyalgia. The FDA has not approved antidepressants to treat chronic pain as of yet, and maybe they never will, even though duloxetine has been approved to treat fibro. But not to worry, clinicians the world over have been prescribing them for the treatment of chronic pain for decades, even when depression is not present. While antidepressants do not treat every type of pain, they're useful in treating neuropathic pain like arthritis, diabetic neuropathy, fibro, migraine, post-herpetic neuralgia, and many more. What's interesting is that, like many other medications, researchers are not really sure how antidepressants actually reduce pain. Antidepressants are believed to work by increasing neurotransmitters in the body, and most often provide only a mild to moderate amount of pain relief, estimated at around 30% for the average person. There are a number of different types of antidepressants, many of which work on different neurotransmitters, providing various mechanisms of relief. Often a patient will receive a lower dose of antidepressant medication versus someone who is being treated exclusively for depression. Antidepressants can typically take several weeks to become effective in treating depression, but can be expected to produce results much faster with chronic pain. It will likely still take a minimum of a week to see results, much longer than traditional opioid analgesics. It's not uncommon for a clinician to resort to antidepressants for the treatment of pain after conventional pain relievers have failed or have produced unsatisfactory side effects. It's also common to use antidepressants in addition to other opioids to address complex pain syndromes like fibromyalgia, for example, or conditions where neuropathic and nociceptive pain are both present, such as is often seen in cancer. Often pain syndromes are exacerbated by the lack of sleep. This can be difficult to address using conventional pain relievers. Antidepressants often offer a benefit of sleep patterns that can help reduce pain secondarily. Since the theory of pain is centered around neurotransmitters and the lack of function or malfunction, it makes sense that antidepressants have value in modulating a pain response. Antidepressants are believed to work by affecting serotonin and norepinephrine, ascending the nerve pathways from the brain to the spinal cord. Antidepressants are classified according to which neurotransmitter they impact. While there are many antidepressants, for the purpose of this video, I'll only focus on three categories which are commonly used to address pain: tricyclics, SSRIs, and SNRIs. Tricyclics are the most often used in the treatment of neuropathic pain. Tricyclics work by inhibiting the reuptake of serotonin and norepinephrine at the synapse. What this means is that the antidepressant blocks the synaptic transmission process of serotonin and norepinephrine and dopamine. This increases the level of these neurotransmitters, and this enhances mood, emotions, and reduces pain. The tricyclics that are suggested to be the most efficacious in treating neuropathic pain are amitriptyline, doxepin, and nortriptyline, among many others. SSRIs, or selective serotonin reuptake inhibitors, work by blocking the reuptake of serotonin primarily, Prozac being the most commonly used for fibro. But Prozac is also not believed to provide a ton of pain relief. SSRIs are suggested to provide mild pain relief. SSRIs are not suggested to be used as effective in the treatment of neuropathic pain versus other antidepressants, which have been labeled a disappointment by some clinicians. SNRIs are also known as dual uptake inhibitors for their ability to block the reuptake of both serotonin and norepinephrine, and they act similar to tricyclics. Currently, Cymbalta is the only FDA-approved antidepressant to treat fibro, and Savella is also an SNRI that treats fibro. So what antidepressant is right for what condition? The answer is not really clear. My position on that issue is that everyone's condition is unique, even when their symptoms may mimic another's, and medication should be used in a trial and error fashion until you can find what really works for you. Working closely with your physician and adjusting dosages periodically is probably best, although relief may come much slower than desired. SNRIs and tricyclics are comparable in effectiveness and are superior for pain relief to SSRIs. Tricyclics have the most side effects. SSRIs have the least side effects. Tricyclics are the most effective at reducing pain from fibro, and sometimes combining an SSRI with a tricyclic can be effective for treating fibro pain. It's estimated that 40% of chronic pain sufferers do not achieve effective pain relief. So while it may not be popular to take antidepressants, they may give you your life back to some degree if you suffer from a chronic pain condition. The benefits, of course, need to outweigh the risks. At the end of the day, you're responsible for your wellness, not your physician's, which means you need to educate yourself about what you put into your body. Thank you.